Good afternoon. As was mentioned, my project title is a retrospective look at the impact of medical and dental integration in a rural pediatric clinic. This, I think, summarizes how many of my patients feel on a regular basis. This tooth here says, hey, guess what? I decided to start hurting today. You didn't have anything to do this week. Dental caries are the most prevalent chronic disease of childhood. They are 5 times more prevalent than asthma and 7 times more prevalent than hay fever. 20% of children between the ages of 5 and 11 have dental caries, and 13% of children between the ages of 12 and 19 have dental caries. What causes dental caries? It's an overgrowth of cariogenic bacteria such as Streptococcus mutans and lactobacilli. Also diets high in refined sugars and carbohydrates, and poor oral hygiene. Untreated dental caries can cause tooth loss, abscess formation, bone loss, systemic disease, and in very severe cases, death. The impact is disproportionate among socioeconomic status, based on socioeconomic status as well as race. So children from lower income families have rates that are almost 2 times as high as children from higher income families. Children of color have higher rates of tooth decay as well. And this graph shows information from the 2015-2016 school year, in which 15% of kindergartners had tooth decay. And as you can see, the rates get higher as you look at children of color, with American Indian children having rates almost twice as high as white kindergartners. Tooth decay can impact the child's overall health, school performance, and family life. Most of you are likely aware that tooth decay is linked to heart and lung disease, stroke, and diabetes. You may not be aware that children who have poor oral health can miss school 3 times more often than children who have good oral health. And that can impact the family. Parents of children with poor oral health miss work almost twice as often as parents of children with good oral health, which can cause a financial impact on the family. And as I mentioned, oftentimes these are families that are already struggling financially. The good news is that childhood caries are preventable. First of all, us providers need to make sure we're recommending that our children see the dentist by the age of 1, as recommended by the American Academy of Pediatrics. We also need to make sure that we're talking with our families about decreasing their children's juice and sugary drink intake, and water needs to be the only drink that children have during the night. The other way that caries can be prevented is with dental sealants, which is a thin coating that's applied on the chewing surfaces of back teeth. The protective shield blocks out germs and food, and once placed, cavities can be prevented by up to 80% for 2 years and up to 50% for 4 years. Another thing about dental sealants is that they are low cost. They are covered by North Carolina Medicaid, as well as most private dental insurers. And we know that children without dental sealants are 3 times more likely to get cavities in their teeth. The majority of underserved people with the majority of dental disease do not take advantage of the traditional dental care delivery system. Knowing all of this information is what made us at my practice at Rural Health Group decide we needed to do something different. So the goals of my project was to make dental care accessible. We also wanted to make sure that we educated our families about the importance of dental hygiene and regular dental care and the link between oral health and overall health and well-being. We also wanted to increase the number of children that receive dental sealants. We started out by educating our staff. We knew for this project to be successful, we had to have the buy-in of our entire staff. So we made sure that our front desk staff, our call center, nursing staff, and medical providers were educated about the importance of good oral health, as well as the behaviors that can lead to poor oral health. Our nursing staff was then required to educate our families about these same topics. At every medical visit, families were asked about a dental home for their child, as well as the last time that their child had seen a dentist. And then we offered oral hygiene instruction to all families, and every child at every medical visit left the office with a new toothbrush, toothpaste, and dental floss. Next, we redesigned 2 of our medical exam rooms into dental exam rooms. These rooms were outfitted with all the necessary equipment to complete a full dental exam, including x-rays. We hired a pediatric dental hygienist to sit in our medical clinic among our nursing staff so that the nursing staff could identify patients who needed to see the dentist. And every patient who had not seen a dentist in the prior 6 months, who did not have a dental home or had concerns about their teeth, was offered a same-day dental appointment, although it had not been scheduled previously. 1 year after we initiated our project, we took a look back to see what the results showed and had it been as successful as we thought and hoped it would be. So we did see that we had an increase in the total number of pediatric dental patients that were seen. There was an increase in the number of children who had sealants placed on their teeth, as well as an increase in the number of restorations or fillings that were placed and the total number of preventive visits that were seen. We also looked at what did our parents and our staff think about this program. So we randomly surveyed 50 parents and asked them 4 short questions, 4 short yes or no questions. First of all, we asked, did you have a same-day medical and dental appointment? Because we wanted to make sure we were surveying the correct parents. We then asked, did you think that the same-day appointments were beneficial? Did you think that the same-day appointments should continue? And would you be willing to recommend Rural Health Group to other parents because of the ability to have same-day medical and dental appointments? We asked our staff some of the same questions. Did they think the appointments were beneficial? Did they think that the appointment should continue? And then the last question we asked our staff were any problems that had been encountered or anything they thought we should change. 100% of our parents and staff felt that the appointments were beneficial and should continue. And we had 96% of our parents say that they would recommend Rural Health Group to other parents because of the ability to have same-day medical and dental appointments. Our staff did highlight some logistical problems that we had not thought of prior to implementing this project. One being much longer than usual visit and wait times. And that was an issue because we only had 1 pediatric dental hygienist. So one of the things that our staff recommended is that because it was beneficial, we should look at trying to hire more pediatric dental hygienists, as well as offering these same-day appointments every day that our medical clinic is open. Currently, we only offer the appointments 3 days a week, and our medical clinic is open 6 days a week. In conclusion, we started this project out of the need to reduce the oral health disparities in target children at high risk for tooth decay. We were able to show when dental care is accessible, it will be utilized. We started closing the dental care gap and reducing the number of children that suffer the consequences of poor oral health. Knowing that tooth decay is an easily preventable disease that has health and social consequences means that all medical providers must educate families and children about the importance of oral health, and that medical providers and dental providers need to work closely together to make dental care accessible and convenient for all. Going forward, we plan to look at whether or not we can expand this model, so offer it on more days of the week, as well as if it's a model that we can incorporate into other clinics within our Rural Health Group system. We also do use some telemedicine, so we've thought about, is there a way that we can incorporate telemedicine into this model so we can access more patients? Thank you.